Mary Fallin joins us. Good evening, Governor.
Good evening, Greta.
Governor, the people who are in the high-risk pool are the ones that, we care so deeply about because they're the ones who are sick. What is going on in Oklahoma? What is this risk?
Well, we are very worried about those people because they're the ones who are the sickest, the ones that need health insurance coverage the most. They're the ones who might have cancer, leukemia, diabetes, heart problems, and they're the ones who are in our risk pools, as they are in many other states. But as we know, the health insurance exchanges haven't worked the way they were supposed to work. And so at the end of this year, December 31st, we have over 850 Oklahomans that are in that risk pool. They're at risk of losing their insurance, and they're the ones who need the health insurance coverage the worst because they're the sickest.
So what are we going to do? What are you going to do? What is the president going to do?
Well, I don't know, but something needs to be done, and the administration needs to do something about this particular issue. Come December 31st, they may not have any coverage at all, and it's a federal issue. And I think a lot of people in Congress have been saying that we should delay the implementation of the Obamacare health care law just because there are so many different glitches that are coming. But it is a federal issue, but it's affecting our states.
But isn't it more catastrophic than that? Because a lot of them are losing their insurance. They've had cancellations, right? And they've got to get into this Obamacare and the high risk. Am I right?
That's right, and they can't.
All right. Well, so here's the problem. If they've had their policies canceled, they are very sick. They're in the high risk. They're up against a deadline. They can't get the insurance that even if we could get them their old insurance back, it doesn't exist to get back. So we're really squeezing these people.
That's right. And it's the people who don't need to be squeezed because they're already ill and needing health care coverage right now. And it's just a very unfortunate circumstance. So my hope is that Congress and the administration will do something about this. Time's running out. It's December 31st.
Like what?
Well, they're
because
going to have to either... I want to delay the implementation of the law. Just to delay the implementation.
Even if they delay the implementation, is that because of the law, the insurance companies, a lot of them have gotten out of these policies to begin with, and you can't order insurance companies. You can't order the insurance companies, that old policy you just canceled, well, now we want you to sell it, and do sell it to a really sick person who's high risk, who's going to cost you more than the premium. They don't even want those people. They don't want the high risk ones.
That's exactly right, and that's why this health care law has been such a mess. We knew it was going to be complicated. The president promised these people that if they liked their health insurance, they could keep it, they could keep their doctor, their premium rates would go down, and we're seeing all those things just haven't worked out and, frankly, just weren't true.
Governor, just on one other note, when there's some good news, I like to sort of report it. The Feeding Oklahoma food drive. Your goal was 1.4 million meals, and according to what I was doing a lot of research on you today and on your program out there, is that the state of Oklahoma and your Feeding Oklahoma food drive, 2.9 million meals to help the hungry in Oklahoma. That's more than twice than what you expected.
Well, thank you. Yes, it was. And, this is a very challenging time when you go into the Thanksgiving and holiday seasons, Christmas time, and people want to be with their families, and we have food insufficiency in America and certainly here in Oklahoma. And so this is my 4th year to do a Feeding Oklahoma food drive. It's one of the ways I can give back, and I'm thrilled with our results. We had so many different companies, foundations, organizations, and people that donated food, and we worked on it for months. So 2.9 million meals is a lot of meals. Thank you for recognizing that.
Well, it's indeed a lot of meals. A lot of citizens around this country really want to help people all the time, not just at the time of the holidays. And I know you guys got hit so badly with that tornado, and Oklahoma's been hurting pretty badly. So I thought I'd give you a shout out for that. So, Governor, thank you. Thank you for joining us.
Thank you. I appreciate it.